actually working. There you are. Or no, is that him?
No, that's probably somebody else.
Oh, what'd you do? Oh, I thought you messed it up.
Good evening, everyone. Welcome to our third virtual Equity Town Hall. We are glad you joined us this evening, and you will hear from our County Board President, Toni Preckwinkle now.
Good evening, everyone, and thank you, Denise. I want to thank you for joining us tonight and welcome you to our virtual Equity Town Hall with Commissioners Deere and Johnson. We'll continue to hold town halls in the coming weeks to hear directly from residents in different areas of Cook County. I'd like to thank all of those who've joined us today, particularly Commissioner Deere, the 2nd District, Chair of the Health and Hospitals Committee, Commissioner Brandon Johnson of the 1st District, Dr. Kiran Joshi, co-leader of the Cook County Department of Public Health, Bill Barnes, Executive Director of the county's Department of Emergency Management and Regional Security, Del Reese Adams, Executive Director of the Justice Advisory Council, and Denise Barreto, Cook County's inaugural Director of Equity and Inclusion, who will be our moderator for this event. Denise joined us only a few weeks ago, and we're grateful to have her on board and lead our equity work at Cook County. Together, we will provide you with an update on Cook County's response to COVID-19 and answer questions during the live Q&A part of our presentation. We began preparing for the potential spread of COVID-19 last December, when we first learned of the spread of the coronavirus in Wuhan, China. In January, the Department of Emergency Management and Regional Security and our Cook County Department of Public Health proactively worked to ensure that resources were in place to assist suburban municipalities and especially suburban first responders, our police officers and firefighters. In February, we began preparing for a worst case scenario to ensure that if necessary, our county workforce could work primarily from home and still carry out essential services. In March, I made a disaster proclamation so that we could assess emergency funding from the Federal Emergency Management Administration and so that we could work quickly to procure emergency services and supplies. I also sent most of the workforce in my administration to work from home and practice physical distancing. To date, the Department of Emergency Management and Regional Security has donated more than 2 million pieces of personal protective equipment throughout Cook County. Emergency Management and Regional Security has coordinated alternative housing for COVID-19 positive residents, first responders, and other essential workers. Emergency Management has also coordinated hospitals throughout the county and the medical examiner's office to assist with their resource needs. The Cook County Department of Public Health has worked diligently since the first positive case in Cook County to conduct contact tracing, answer resident questions through a multilingual hotline and email, continuously update community organizations throughout the county on weekly calls, and coordinate the city and the state on our efforts. Dr. Joshi will go into some detail on their efforts shortly. We've also made significant efforts to depopulate the Cook County Jail and the Juvenile Temporary Detention Center because jails are petri dishes, and social distancing is just not possible under those conditions. We've received positive reports recently that COVID-19 is contained in the jail. And this week, we were able, thankfully, to reinstate in-person visits. Now let's talk about the equity piece. I've made racial equity a priority in my administration. In 2018, my office published a 5-year strategic plan, the policy roadmap to guide our work. We looked at ways for government to advance equity through policy and practice. Last month, my office released the Cook County COVID-19 response plan for response to equitable recovery. This plan follows Cook County's initial response to the crisis and outlines priorities for the next several months. In a continuation of the county's commitment to advancing racial equity, the plan is focused on addressing inequities that have been worsened during the pandemic. We're seeing firsthand during the COVID-19 pandemic how glaring the inequities are. We know that in normal times, our Black and Brown communities struggle with disinvestment, access to health care, food insecurity, lack of economic opportunity, language barriers, and other forms of inequity. These inequities are only exacerbated during a public health crisis. Now in June, we are starting the difficult work of recovering from the pandemic. This is not work that will happen overnight. We'll feel the impacts of the pandemic for years to come, I'm afraid. And I stress that the pandemic is still far from over. As businesses begin to reopen their doors, it will be a challenge for many to stay afloat, particularly in our Black and Brown communities. One way Cook County is helping small business to recover is through the Community Recovery Initiative. This initiative is designed to help those hit hardest by the pandemic. On Monday, we launched a $10 million zero-interest loan fund for small businesses, not-for-profits, and independent contractors in suburban Cook County. Small businesses can apply for up to $20,000. Independent contractors like rideshare drivers, food delivery workers, and gig workers can apply for up to $10,000. Again, it's a 5-year zero-interest loan. Applicants can visit www.cookcountyil.gov, that's gov/recovery, to learn about eligibility requirements and how to apply. The application period will be open until June 18th. We understand that $10 million is not enough to help the thousands of small businesses needing support at this time. So we will continue to try to find other ways to provide support for them. We are hopeful that it will offer some relief, however. We've also made a comprehensive technical assistance network available to businesses, nonprofits, and independent contractors throughout Cook County as part of the initiative. To date, we've helped businesses access more than $3 million from the federal Paycheck Protection Program, businesses that would have had tremendous difficulty accessing these funds otherwise. The Technical Assistance Network is available to all Cook County residents. Tonight, we're here to listen to the needs of our residents directly from residents themselves. I look forward to the productive discussion and answering some of your questions in the Q&A period. Now I'd like to turn it over to Commissioner Deere to have some brief remarks, and thank you all.
Thank you so much, Madam President. I also, too, want to commend you on your effort and doing such a phenomenal job with bringing forth equity. We all know that it is very, very important that we not focus on equality, but focus on equity. As most of you all know, I introduced a resolution on last July, almost a year ago, declaring racism a public health crisis in Cook County. To date, over the last month or two, I've received calls from various states who counties are introducing similar legislation that we did. So this is an issue. It is an issue because we have to address the social determinants of health. We have to ensure that Black and Brown people have access to public health. And we have to understand that this is an endemic problem, as the president always says, and we have to do something about it. So I am glad to be here tonight. We know that COVID was contracted by a great deal of African Americans and now Latinos simply because of poor access to health care. Lastly, I'll say that we have a consistent number of people who are in the criminal justice system. We are the most criminalized or most incarcerated country in the United States of America. We represent 5% of the global population and 25% of the global incarcerated population. We release 600,000 every year from the federal government, 26,000 to 5 zip codes in the state of Illinois. And right where I am here in North Lawndale, 26,000, a great deal of that 26,000 comes to these 5 zip codes. In North Lawndale, it's 2 of them. What am I trying to say here? the same issues with racism and classism find themselves right with our many brothers and sisters who are incarcerated. And again, I'm thankful that our president has taken a stand on this and is moving the train. Thank you, Madam President.
Thank you very much. And now we'd like to hear from Commissioner Brandon Johnson.
Thank you, Madam President, and good evening to everyone, and to my colleague,
Good evening.
Commissioner Deere, who I'm grateful to be able to serve alongside as we represent the residents of Cook County, and deeply humbled and appreciative of the leadership that you have displayed, Madam President, and of course, my colleague, Commissioner Deere. I'm equally impressed with the voices of our people that have been raising their voices in an unprecedented time in our nation's history, where the threat, of course, of the global pandemic that has certainly ravaged communities throughout our county, but also raising their voices around the systemic racism that continues to grip the life, literally, out of Black communities in particular, and absolutely brown communities as well. And so I'm happy and pleased to be joined with residents from around the county to have an important conversation about how do we make sure that our response is bold and audacious, that we're able to address the inequities that have already been laid out, but do it in a way that sets us apart from generations before us. That we have to be incredibly strategic, but we also have to be, more importantly, that much more vigilant to ensure that the type of injustices that happen at the hands of the state, particularly by police, that is brought to account. That the inequities that exist within our healthcare system, that we should be calling and demanding the expansion of healthcare services and really making healthcare a human right. But we also have to be very vigilant about providing the absolute security that we need in our communities. And that security requires us to have W-2s. The unemployment rate that continues to harm and set our communities backwards because of austerity budgets and the interests of corporations and power structures that do not see the benefit of not only our lives, but our livelihoods. And so I'm looking forward to today's conversation. And of course, more importantly, I'm looking forward to the work ahead.
Thank you, Commissioner Johnson. I'm back to just give you a couple of few housekeeping notes before we get started with the presentation. First, please mute your phones. And if you're joining us by phone and want to verbally ask a question, there will be time for that at the end, and we'll give you instructions on how to make your voice heard. This event is being recorded and will be posted on YouTube tomorrow, and all who've RSVP'd for today's event will receive a copy of the PowerPoint as well as the YouTube link. At this time, I would like to introduce Dr. Joshi, our Senior Medical Officer, to present the public health response to COVID-19. Dr. Joshi?
Thank you so much, Denise. We haven't met, but I really look forward to getting to know you, and I'm so glad to hear you're on board. Thank you, commissioners, and thank you, Madam President, and good evening, everyone. Next slide, please. So the Cook County Department of Public Health is the state certified public health department for almost all of suburban Cook County. Just a quick note that the city of Chicago, Evanston, Oak Park, Skokie, and Stickney townships are all served by their own certified health departments. Our work, whether it's investigating a communicable disease, case managing high-risk infants, or preventing tobacco use, is always focused on advancing health equity. It's in our mission and it's in our DNA as an organization. Next slide, please. We wanted to give you all a sense of the work that CCDPH has been doing in response to COVID-19 and highlight the health equity approach that drives all of our public health work. This slide shows you some of the data from our Shiny app, which provides data on numbers of cases and rates of infection in the suburban municipalities in CCDPH's jurisdiction. We're really proud of being able to provide access to these numbers to community members and to provide that data in ways that allow us to analyze rates by race and to identify disparities in cases and outcomes. Our app also links to the medical examiner's office death data, where local level information can be found. Just to provide everyone with a little bit of context, last year, suburban Cook County saw about 20,000 communicable disease cases in the whole year. So that's all communicable diseases all year long. And so far, as you can see here, we've had over 32,000 cases of COVID-19 in suburban Cook County in a little over 5 months. Next slide, please. We wanted to briefly touch on some other aspects of our work during the COVID-19 pandemic to give you a sense of the entirety of our response. We're highlighting how our response, but we really want you to know that these activities, many of them are ongoing, and our response builds on the equity-focused work that we do every day. So beginning with infection control, our staff works every day to help contain the spread of COVID-19, particularly in congregate settings like nursing homes. We're in contact with more than 200 facilities to provide assessments, give guidance, and help them make the changes needed to keep their residents and staff safe. In collaboration with the Illinois Department of Public Health, we're working with volunteer strike teams to provide more intensive on-the-ground guidance to the most impacted long-term care facilities, many of which are in our communities of color. I'm sure you've heard about our contact tracing work in the news. We announced the grant that we were awarded today. We're in the process of staffing up a robust COVID-19 contact tracing program to gather information from people who are positive cases. Collecting the information helps to mitigate the spread of disease by helping people know that they've been exposed and when to stay home to avoid infecting others. We plan to begin hiring for this in August and are committed to hiring people from the communities that are most affected and most vulnerable to COVID-19. Until applications are ready, people can submit an interest form by visiting our website. Workplace safety and violations, we're working with the Illinois Attorney General's office to address complaints about workplace safety. When we investigate a complaint, we conduct or we work with community health inspectors to conduct assessments. These are done either on site or by telephone, and we provide technical assistance to businesses about things like implementing social distancing in the workplace, precautions they should be taking for ill workers, and other policies that they can implement to improve safety for their staff. Alternate housing. So this is an initiative that I'm proud to say we have stood up in collaboration with the Cook County Department of Emergency Management and Regional Security. We've established a pool of hotel rooms to serve medically stable, low-risk COVID patients or their families if they cannot isolate at home. We also offer respite housing to first responders, corrections officers, and healthcare workers, as well as workers who work at homeless shelters. Community engagement. Our community engagement team is collaborating with key community stakeholders and service providers to share critical COVID-19 information and connect residents, especially those in our most vulnerable communities, to resources to keep them safe and healthy. They also host regular meetings with our Southland co-design group. We have a great group of community residents who are all grassroots leaders in their neighborhoods who weigh in on community needs and in turn help inform our work. Next slide, please. Finally, I wanted to ensure you that all of this work is being conducted with an eye on the data and a recognition of how this pandemic is playing out in our communities. We're deeply troubled by the disparities that we're seeing. There are considerably higher rates of COVID-19 illnesses and deaths among African Americans and Latinx people as compared to their white counterparts. In suburban Cook County, which is again our jurisdiction, the rate per 100,000 African American residents is about 3 times higher than their white counterparts. The rate for Latinx residents is 4 times higher. So it's not surprising to those of us in public health, as Latinx and African American residents have historically been disproportionately affected by heart and lung diseases, cancers, diabetes, and the other underlying conditions that put them at increased risk for more severe illness and death from COVID-19. Those health outcomes are the result of years of racist policies like redlining, limited access to health insurance and healthcare, and community disinvestment. So COVID-19 is really revealing the health disparities that we've long known are rooted in historical racism and discrimination. And even worse, COVID-19 is likely to worsen or deepen the disparities further if we don't work together to address the inequities that unjustly affect some of our most vulnerable residents. While we need to focus on the particular methods to keep us all safe in the short term, things like physical distancing and wearing masks, we need to also continue to advance progressive social policy focused on the structural determinants of health. Policies like paid sick leave, increases in the minimum wage, and the bill that Commissioner Deere mentioned, all of which will reduce inequities in the long term. CCDPH is committed to reducing structural racism, a root cause of health inequities, and to advocating for pro-equity policies to protect and enhance physical and mental health. Next slide, please. Before I end, I wanted to provide you with some ways to connect with us. Our website pages on COVID-19 are now all available in both Spanish and English. We have a dedicated email and hotline number for COVID-19 questions, and we can respond in many languages so that any resident of the county can take advantage of these services. I want to end by saying this. Most people with COVID-19 recover and many never show symptoms. Despite this, we must proceed cautiously. Remember the special lives that we've already lost, and let's work together to prevent the loss of more, particularly those who are most vulnerable. Thank you.
Denise, we can't hear you.
We have come to the point in our session where it's the question and answer. Thank you, Madam President. Again, if you want to ask a question, please, if you're joining us by phone, to unmute yourself, you're going to have to use *6. Otherwise, you can unmute yourself and answer. Just want you to know that we have members of the Emergency Management and Regional Security Department, Justice Advisory Council, and our Bureau of Economic Development, as well as our Cook County Public Health Department, all available to answer your questions. This is your opportunity to ask your officials what you might need. What resources can we provide? How can we help? You're also welcome to write your questions if you don't feel comfortable speaking them. You can write them in the chat and I will be happy to read them.
I believe that someone's asking a question, but we can't hear him.
Someone said they submitted a question online. Patsy said she submitted a question online and we're trying to identify that. Our first question says, are we able to set a virtual meeting with any of the presenters?
So I think that we're not able to do that at the moment. However, if you have a particular question that you want to direct to one of the presenters, we'll be sure that you get an answer.
You also can raise your hand button if you're on the Teams app, and that way we can have some of our helpers that are more technically sound than myself get your question. Oh, I see a hand. Can we unmute him? Hold 1 second. Mr. Cassie, you're on mute. Can you unmute yourself? Because I can't unmute you from here. While we're figuring, yes, thank you. Thank you.
Okay. Thank you. I'm humbled by this presence of public service people, and I've never been in front of anyone of this caliber, so I might lose some words here in a way of expressing myself. I have been very active in the construction business for the last 25 years. I've worked with companies that supplied materials in Chicago. I probably have done approximately about 35 to 45% of the specifications of terrazzo flooring in Chicago. And so I have dealt with contractors and architects and developers and the city as well. And Commissioner Deere, you touched a point that I have been dealing with for quite a while, and the word was equity. My question is, we're living in the world of diversification, and how do you compare or relate diversification to equity as it is now being used in the world we know now? Is there a difference in diversification versus equity, or is there a relationship within these terms?
I think that there is a relationship. Diversity means just what it does. Means that you're going to have Black, Latinos, white, etc. So you're going to have all of those individuals. And some people have believed up until this point that it was important to have equality. But equality means that they all started at the same place. We are pushing for equity. Equity is based on need. So some other individuals may have, it may appear that they've had more for a long time, but the individuals who happen to be minority haven't had anything for a long time. So we have to push to get them more now because they've been broke for a long time, if I'm allowed to use that word. And so we want to push for that. That's why I fight so hard on the Cook County Board and on the hospital board to ensure that minorities have minority contracts so they can get a percentage of those contracts, because so many years have gone by and they haven't gotten any contracts. I hope that answered your question.
Yes, I think I relate to that very well, but I want to push you and say, or put something in your mind to think about. Diversification, sure, as I'm concerned, deals with parity. And somebody, thinks that I'm poor and innocent and naive and wants to help, and so gives me something. Equity says, no, you need to give this person because he's a human being and he has the right to ownership. So it's not a do good attitude. It's my right.
Absolutely not.
That's so right. I think that diversification thought process has to change. If we're looking at equity, and as far as construction is concerned, we need to look at who's supplying the material. In the building that you live in, you're right now sitting in, there were approximately about, just in your room, at least 12 people that were in front of the architect selling their material. And in the specification world, or in the construction world, I should say, construction starts in the plan room.
Absolutely.
And if there is no minority in the plan room, I guarantee you there is no participation. And this verse, or this word diversification, means let me pick out of those hundred thousands of people, my friends, or those who get along with me well. And that we have to look at that theory, that system.
Well, let me just say this. I want to take it a couple steps past what you're saying. Personally, I am not interested in just getting equity done. I want to get equity done, get these individuals some contracts, mentor them so that they can become the prime. So there's no more diversity anymore. They are the prime. And then they can mentor some more people. This is a bigger plan. I've been going all around the city of Chicago and county the last few weeks. What we're experiencing right here today is an opportunity. It is an opportunity to bring forth systemic change, not just for now. We got to project this out 10, 20 years. That's why I was so happy when Michael Jordan decided to give $100 million. But his stipulation was, this is over 10 years, not just for this year. He's creating generational change. And that's what we have to do.
I thank you very much. And I really believe that the question of who's supplying that, in that project. The question is how many minorities are coming in supplying material. We may have to create suppliers in every aspect of the trade.
That's right.
Thank you, Mr. Cassidy. We have a lot of questions that have come in. The first one from, I see a couple of hands as well. I would like to read one that came in while he was talking. Can any business apply for the $20,000 loan, and what are the parameters for them? Is there a credit score requirement? And how soon do we get the funds? Can this slide be emailed? All the slides will be emailed to everyone who RSVP'd. So just I can answer that one. Someone from our economic development.
Oh, why don't I respond?
Hi, this is, okay.
Oh, we got a responder. Good, thank you. Carl?
Hi, it's Carl Bradley in Bureau of Economic Development. I think that make sure I get all the questions answered correctly. It's targeted to small businesses. Small businesses are those 25 employees and under. It also includes the component of gig workers and contract workers that work under a 1099 IRS system. So those are our smallest and most in need small business persons that are out there. The second part of the question is, what's the second part there?
It was, is there a credit score requirement?
Yeah, there's no credit score requirement under this component here, period.
And how soon do we get the funds?
Application round started this week, Monday. It closes next Wednesday. We project around July 1st to be the first initial distributions.
Thank you. I see some hands. Can we have some? I've got two hands up for questions.
Yes, this is Michael Rabbit. I'll go ahead with mine if that's okay.
Yes.
So if we're going to talk about equity and need, I think it's very timely to talk about that in the context of police, public safety, and the discussion that's happening nationally around defunding the police. And many communities look at public safety, the need in public safety, as not just more police. It's making the investments in communities that we've been talking about in this meeting. How do we invest more in healthcare and in mental health, in housing, in transportation? So I think it's appropriate to have a conversation here today about, if we look at the Cook County Sheriff's Police Force, what do we still need? What do these communities really need in terms of the number of Cook County Sheriff's Police, and how can some of those funds be better used and create more equity in the community through a shift of those funds to what the community really needs.
All right, so maybe I should explain. We have a pretty modest sheriff's police force. There are 100,000 people in unincorporated Cook County, as opposed to 5.2 million in the county itself. So we have a pretty modest police force. Most of the money in the sheriff's department goes, frankly, into the jail, the Cook County Department of Corrections, CCDOC. And we have been working to reduce the jail population since I began a decade ago, and in earnest with our partners since 2013. When I came into office, the jail population was 10 or 11,000 people on a daily census. It's now down, we got it down to about 4,000 in the midst of the pandemic as a result of the arrests around the protests and increased intra-communal violence over the last couple of weeks. The jail population is now 4,500, but it's still a substantial reduction from where it was in the beginning of the past decade. So we've made some real progress, and as we've reduced the jail population, of course, we've reduced our investment in jail guards, and that's frankly where the sheriff's dollars go. And for most across the county, about 80% of our expenses are personnel, and we're reducing the number of people that we need as jail guards because we've dramatically reduced the jail population. We've demolished 2 divisions in the jail. And we've got 2 more scheduled for demolition by the end of this year. So we're trying to reduce the jail campus, both because we've made great efforts to stop detaining people in the jail who are accused of nonviolent crimes, and because, as I said, we've been demolishing the older parts of the jail campus as we've proceeded with reduction in the jail population. So that's where we've been focused, frankly. It's on reducing the investment in the sheriff's office through making our jail a place for people who are accused of violent crimes as opposed to people accused of nonviolent crimes who are awaiting trial.
Thank you, Madam President.
I appreciate the question, and thank you, Michael, for raising it. And for those who are on the call, this is Brandon Johnson, 1st District County Commissioner. And look, I mean, I think if we look across the country, that there is an overwhelming presence of policing in all of our spaces, whether it's in schools, neighborhoods, that there is an opportunity for us to reimagine what public safety means. I've said this before. It wasn't the police officers riding around the neighborhood that made me feel safe. It was the fact that I had a father with a W-2. And I think that your point about investment has to be in lives, and where we have opportunities at the county level, particularly with the Justice Advisory Council that supports efforts to provide models of what restorative practices need to look like. Investing in housing, where we know the number of families, I think just in Chicago alone, 40 Black families are forced out of Chicago alone. That's the security of our communities, right? When individuals do not have access to jobs and affordable housing, that depletes a neighborhood, and it forces the concentration of poverty into particular spaces where the only response to that has been more police. And what I believe we need to do in this moment as elected officials is that we recognize that the work that we've done over the last several years, there's still more work to be done. And I'm saying out loud that we do have to reimagine what our investments need to look like. And the last thing that I'll say is that those investments have to speak to the needs of our constituency. I know that the board president, President Preckwinkle, has put together this rapid recovery to COVID. And one of the things that I appreciate in the report, and I've been in conversations with her about, is around internet and broadband and having access to it and the job creations that can come from that. Now, my personal opinion is it should be a public utility, right? And I think we should continue to push in that direction. But I think ultimately what we have to do is get away and dismiss this notion that the practices of mass incarceration, the practices of over-policing, the practices of arrest have not made our community safer. In fact, it has caused more detriment to the vitality of our existence than we've seen in a generation. The fact that we still have more people that are incarcerated and detained that were in bondage in 1865 is a moral crisis. And so I would encourage folks to continue to organize and push us in this moment to imagine where those investments can be and how do we ultimately create sustainable communities that keep our families whole and not policed.
I want to thank Commissioner Johnson for giving a broader response than I did. My default response is always what's happening in the jail because that's been the focus of so much of our work.
I did read your report, Madam President. I did my homework.
Well, listen, thank you, Commissioner. Thank you. That your response was much fuller than mine. Thanks.
And it was
if I
intended
may-
as a broader question, so thank you very much.
Yes, and to this is Del Reese Adams, Executive Director for the Justice Advisory Council. Just to piggyback on Commissioner Johnson's point, the president does not give herself enough credit. Since she's been in office, we have every year increased that investment in community. And this is an opportunity. I think we've been fighting a real good fight of saying we cannot reduce recidivism or violence in our communities without that investment. And so now we may be at a point where we can do all things at the same time. We can reimagine public safety in our communities. We can give our communities the ability to be resilient and sustainable, and we can invest more and increase that investment in them. And so we've been sort of doing that in pockets, and now this is an opportunity where the entire country understands how important that investment is.
Thank you. Let me say, Del Reese Adams is our director of our Justice Advisory Council. And in my administration, we began to make investments, not simply in the jail campus and the sheriff's police and the courts, but also in anti-violence, anti-recidivism, and restorative justice initiatives. And we have a whole network of not-for-profit delegate agencies that do that work on behalf of the county and that we support them.
Thank you, Madam President. I'm going to read a question and then we're going to take Steve Johnson's hand, who's up. Someone wrote that they participated in the Cook County Department of Public Health Community Engagement meeting right before this one.
We lost you. We lost your vote. We lost your audio. Denise?
It's okay. It's
Yeah.
Kieran. I read the question. It's Dr. Joshi.
Okay, excellent.
Yeah, I think that may have been a miscommunication. Those positions will be posted shortly, and we will certainly make a communication about those to our networks and on our website when they are.
Excellent. Steve Johnson, you had your hand up. You can have the mic if you unmic yourself. Unmute yourself. And he may have changed his mind, so let's go find another question. So it looks like you got his question answered. All right, I'm getting to what actions is the county taking to improve access to good medical care, good food, and good housing? What is the budget amount for these efforts?
Okay, so let me say a little bit at the beginning. The county's budget is $6.2 billion. About half of it is public health. That is our health and hospital system, our Department of Public Health, our facility at the jail. That's Cermak Hospital. So half of our budget in the county is healthcare. And for 180 years, we've taken whoever comes to our door. So race, gender, sexual orientation, documentation status, whether or not you have any insurance, we take everybody who comes to the door. So that's been our mission for 180 years. Now, there are other folks who might want to talk about. Dr. Joshi, why don't you talk a little bit about the Department of Public Health's work?
Thank you, Madam President. We certainly have while we don't provide any direct clinical care, we certainly have a role in a number of these areas and work with and through our partners on initiatives that address food insecurity and healthy food, that try to connect individuals that don't have funding, for example, preventive services like cervical cancer or breast cancer screening, to access to those services. And I can't remember the third piece. I believe it was about housing, but we go into people's homes and do lead inspections. And for individuals that can't afford to rehab or renovate their homes, we have monies that could be granted to them for those purposes.
And let me just add, the Housing Authority of Cook County, which is comparable to the Chicago Housing Authority, the CHA, HAC, has been strongly supported by my administration as they've looked to renovate existing facilities, both for seniors and family members, and to build new affordable housing in suburban Cook County. So we have used our federal resources, community development block grant money, and where is Carl Bradley? Carl, I think, can speak to this maybe. We've used our county resources to support the Housing Authority of suburban Cook County, HAC, as it has, as I said, renovated properties and constructed new affordable housing.
If you wish me to speak to it more, just let me know.
Go ahead, Carl.
On the housing side, am I providing the feedback on this? On the housing side, we've got significant efforts in the suburban areas of Cook County. Annually, we spend about $6 million of our home money toward creating affordable housing, and then we get other resources from CDBG to do the infrastructure and the component parts around these areas to make sure we can do more development. But that development goes across the whole county, from Ford Heights north to even areas around Schaumburg. So we're covering a massive amount of area with just a little amount of funds. So our goal is to increase others to do the investment in this area with the state, with the federal government. And we effectuate probably over 500 units a year easily, sometimes up to 1,500 units per year of affordable housing that meets some of the most vulnerable at that time of our population, from homeless to folks who are just looking for quality housing in just good areas. And that's just the quality that we want to have throughout the county. We get to certain hard hit areas also. But
you need to speak up, Carl, or get closer to the mic.
Yeah, we hit hard hit areas also, but we also hit the, some of the more economically strong counties too. But we put affordable housing in all the areas.
And if I could, speak to that type of collaboration, there is a unit that we're hoping to break ground in the western suburbs soon. To that point, the village of Maywood, there's a level of collaboration that's taking place there that's going to provide opportunities, particularly for our seniors. But I think to this the question that was raised about, appropriations. Look, and I'm going to repeat this over the next 20 minutes or so. We have to do more is the bottom line. And the struggle, of course, there's a lot of great ideas that I believe people have to help resolve the housing challenges that we have. I believe last year there was a study that was commissioned. I think it's roughly 50% of Cook County renters are living in unaffordable units. Like that's half of our county is paying rent and they can't afford to live there. But these investments require like the political will and the organizing of our constituencies to put forth the demand so that we can bring some resolve. Like you have advocates a part of this call tonight. I mean, besides myself and Commissioner Deere and obviously the office of the president herself, have made it very clear that we want to expand and have more opportunities for people to live. I would take it one step further, is that there are a number of individuals like myself. When I first purchased my home 10 years ago, I didn't have enough for the down payment of a home. right? I was a public school teacher, and President Preckwinkle can appreciate this. I'm sure I made more in my first year than she did as a teacher. But even as a first-year teacher with a master's degree, by the way, we could not afford a home in Austin. And if it weren't for programs and opportunities for down payment, we wouldn't be homeowners. And so again, I think we have to think beyond the limitations of our own imaginations and figure out how we push us as a collective to demand the type of revenue that can meet the needs of our constituencies.
Commissioner, if I could respond, there's a comprehensive list of what we do for housing. One of the critical elements is to get folks into houses to buy them, because that's the biggest subsidy in the form of tax reductions, and also the biggest form of investment, because people will invest in a single family home if you're willing to put down those dollars. So the county does have a down payment assistance program. I couldn't list everything, but we have a myriad of things that are touching a lot of people. Do we have enough resources? No, but we're also looking to expand, and we're always looking for new efforts and new ideas. So we welcome those. That's a challenge for all of us, I believe, is to make the county more affordable throughout.
Thank you, Carl. Move your computer back because we can only see half your face.
Oh, that's probably a good thing for most people.
No, it's not a good thing. Move back.
All right, we have another question that says, what are the plans to bring your employees back to the office? Specifically, the health system has yet to roll out one, was the full comment. So what are the plans?
Okay, unfortunately, I will have to get somebody to get back to you on this, because I know a little bit about what's going on in offices under the president, and it's sort of, we're kind of gradually coming back. But I don't know what the plans are. I presume you work either at one of our clinics, which has not been open. We've been doing telemedicine, or administrative functions. I can't speak to that. So we will try to find the answer and get back to you. I apologize that I don't know.
And good afternoon, good evening, everyone. My name is Sandy Lewis. I'm the Director of External Affairs. I can only ask you to be aware of the questions that are answered. Some of your questions might have already been answered.
Okay. Thanks, Denise.
So there are no hands raised at this time, but this is your last shot if you want. We did go through the questions that were in the chat already. Oh, we have a new question. Hold on. And you can unmute yourself. We have actually a question from someone who hasn't spoken, Mr. Casse. Hold 1 second. There's someone by the name, can you hold 1 second? We have somebody who hasn't had a chance to speak tonight by the name of Rose. I see your hand is raised in the Teams. Please unmute yourself and ask your question. Maybe she changed her mind. And it's unraised now. So anyone else?
Can you hear me?
Yes, we can.
Okay. This question is for Ms. President. And I wanted to ask if in this drive for equity, is there room for increasing trade schools, general education in the population, in apprenticeship, and so forth and so forth, but basically increasing the skill rate of the people that we're trying to help, so that there is more professionalism in the trade world?
Well, I'm a teacher by profession, and so I'm always supportive of investing in our young people, particularly in post-secondary education for young people. But let me caution you, the county does not have responsibility for education. Half of our budget is public health. About a third of our budget is public safety. That's the jail and the courts. And the rest is sort of everything else. But none of those things are education. Education is a local function of our cities, towns, and villages. So we don't really have an education agenda. So while I can speak personally about the importance of trade school education for young folks, a broad range of opportunities for young people as they emerge from high school. Not everybody wants to go to college. Not everybody will do well in college. We want to encourage post-secondary education, however, of a variety of kinds. And surely opportunities in the trades are one of those things we want to encourage.
Thank you.
Hi, this is Del Reese again from the Justice Advisory Council. I would just add to the president's statement that we do have some community-based organizations who are funded under our violence prevention and recidivism grants who are specifically helping returning residents, and they do offer some training, post-secondary sector-specific training for that particular population. So it's not under the county, it's county supporting organizations who do that specific work for those returning residents.
Thank you, Del Reese, for the correction.
And what I will add to, and thank you, Del Reese, that's essentially what I was going to respond to, the number of organizations that are funded through the county and other organizations that are seeking funding from the county. As Commissioner Deere knows, we get a lot of requests, and most of those requests, I'm sure, go towards the Justice Advisory Council. But I mean, I know that there are organizations like the Ma'afa Project on the west side of Chicago, where young boys, young men are getting a second shot at life, and they're going through mental health recovery. And I'll certainly defer to our mental health expert, Commissioner Deere, on the value of that. But they're also learning the trade. And I think what we're trying to impress upon those who are listening today is that all hands have to be on deck here. And there are some constraints that we have within government, but the people are not limited to what you can demand and what you can organize around. And so where I believe that we have an opportunity, to your question, Mr. Casey, is that, again, as a public school teacher as well, still the best job that I've ever had in my life, that we do have to find ways in which our levels of government can collaborate, whether it's through our Justice Advisory Council or the larger advocacy to see to it that these options or opportunities are made available within our public schools, and individuals who come out of high school that are looking for a deeper connection. There are ways in which it's not too late at 18. It's not too late at 19. If it doesn't happen in high school, it doesn't mean that it doesn't have to happen. Trust me, someone who took a long time to get a bachelor's degree, I'm so glad that people did not, they were patient with me. And so I think part of our effort has to be those organizations that are capturing the imaginations of our young people, sometimes even after high school. That's where we believe as a county, we have opportunities to further engage folks through a pathway of trades.
Thank you. If I could add to that comment, and I appreciate that, the point that I brought up is because the claim is most general contractors or primes claim that we don't have too many qualified subs, and therefore, the opportunity is not there for them. So we need to answer to that question somehow.
Well, I will add again and highlight the work of the JAC, because I think a lot of what you're asking for is being covered by them. And I will say that as it relates to, so there is a workforce development component that is being covered through JAC. My all-time favorite is that there is a mental health and co-occurring disorder component that is covered by JAC. They are now holding reentry roundtables to eventually do more work around reentry as people are coming out of jail. Remember, I started out giving you statistics about our Black people who are the most incarcerated people in the world. And so we want them to come out and be able to work on those construction sites, because we know their white counterparts have been coming out of incarceration and working on those construction sites. We want to be able to do that. And I think the groundwork has already been set by JAC, which is one of the only, or one of the few components of Cook County that do work inside the city and outside the city. So I think we are moving in the direction of accommodating your question. We aren't quite there yet, but I think we're going to get there.
Thank you.
We have one last hand that's up, Irene. Can you unmute yourself? We can see you talking, but not, yeah, like me, like I've been doing all night. I've been modeling that for you. Still no.
Hello, can I ask a question?
Sure.
My name is, hello to everyone first. My name is Veronica Lopez, and my question is the county is going to have a better plan to assess the properties in the county? Because I'm a single mother and my house was valued wrong, very wrongly.
Is someone on from the assessors?
Yes. Yes.
Thank you, Ms. Lopez.
Madam President, you have to unmute yourself.
There we go. Thank you. I should respond. I don't think we have anybody on from the assessor's office, but if you go to cookcountyil.gov, you can find the assessor. If you live in the south suburbs, the assessor just adjusted the assessments in the south suburbs to reflect the downturn in the economy, and he intends to do that across the county before the end of the year. So there'll be adjustments in assessments of property before the end of the year to reflect the economic difficulties that we find ourselves in. But if you go to cookcountyil.gov and look for the site of the assessor, you can find out how to appeal your property tax assessment. And that's probably what we would like to do. And you can do that online. It's pretty easy. There's no need to hire a lawyer. You can just file an online application.
Thank you very much, Madam. I appreciate it.
Thank you for your question. So I'm going to read what Irene was going to say, because she said that she's having a little bit of unstable internet. So the Chicago Cook Workforce Partnership is a partner of the counties. This is to address the earlier question about training opportunities for construction specifically, sir. Chicago Cook Workforce Partnership is the partner that has training programs for construction. You might be able to refer there. Thank you, Irene. All right, here's a question. Here's another question. Is it possible to submit an innovative, unsolicited proposal to provide public health initiatives throughout your current Healthy Hotspots program for local community support using the faith community to volunteer faith, tangible, and volunteer assets? Who should it go to? Who should it go to if there's not an RFP for this particular model to expand your current program?
I'm sorry, I lost you on that question. Can you help me?
Yeah, is it possible to submit an innovative, unsolicited proposal to provide a public health initiative through our current Healthy Hotspots program So we currently have a Healthy Hotspots program, and they're wondering if there's a way to this might be a question for Dr. Joshi.
I don't know anything about Healthy Hotspots, so hopefully Dr. Joshi.
Dr. Joshi.
Hi, everyone. It's Dr. Joshi. So yes, that's correct. We do have an existing Healthy Hotspots program.
Maybe you could explain what it is, Dr. Joshi.
Yeah, absolutely. So that program has existed for many, many years. And it essentially, it began as an effort to really highlight places where, partners were doing things that benefited the public health. So if, for example, a municipality adopted a Tobacco 21 ordinance, before the state did, we would designate that municipality as a healthy hotspot. So it's sort of like an umbrella kind of branding campaign, right? So we don't have any RFPs open for that now, unfortunately, but I am pleased to say that we do intend to have an RFP process to engage community-based organizations to assist with outreach to the community around our COVID-19 contact tracing initiative. So more information to follow, but please be on the lookout for that.
Excellent. Our next question comes from questions that were sent to us ahead of time. What is Cook County doing for people with disabilities who live in congregate housing or nursing homes to protect people of color who have higher rates of chronic conditions? Are you working with the city of Chicago and the state on this?
Dr. Joshi.
Dr. Joshi.
Yes, ma'am. We certainly are. As I mentioned, we're engaged and in contact with over 200 facilities throughout our jurisdiction, and this really runs the gamut from places that are nursing homes to places that are facilities that house individuals with developmental disabilities. So it's really a wide variety of places. And yes, we partner mainly with the Illinois Department of Public Health, but we are also in contact with our partners and good friends at the city about cases that may sort of cross boundaries. In general, we try to ensure that we're aware of cases as they develop, and we offer sort of technical assistance and support to the individual facilities. Our efforts have been augmented by our good friends at the state because they've been able to provide staffing resources that can actually go out to the facilities and liaise with them on a one-on-one basis. And so some of the stuff that goes into this is trying to manage how individuals with multiple drug-resistant infections and like there are a lot of those, unfortunately, a lot of those folks in nursing homes, how they're managed. And that gets really tricky really fast. So oftentimes a lot of deep technical assistance is required.
And Denise, if I could just jump in here.
Absolutely.
The Cook County Board of Commissioners, I introduced a resolution last month to address this very issue. I believe now, as the state, or at least half of COVID-related deaths are tied to nursing homes and long-term care facilities, and that's quite harsh and very difficult to even relate. I had a couple of constituents approach me about a particular facility, of which our advocacy, as Dr. Joshi indicated, started with the Illinois Department of Public Health. And Cook County Department of Public Health, though we don't have direct oversight, has been very helpful and instrumental in providing the necessary technical support where the IDPH highlights or uncovers where there's either bad actors or just areas that a particular facility has not just been able to meet the CDC guidelines. The last thing that I'll say is part of this resolution that we'll discuss next week around this issue, it goes back to some of my initial thoughts about how at the county level, we are doing the very best that we can, and we're going to work even harder to engage other levels of government. And I'm careful just because, I don't want to imply that other levels are not doing their job. But what I will say is that we need to collaborate with other levels of government. And part of our resolution is centered around how the county, the state, and the federal levels of government can come up with a plan to really, stress stronger regulations and staffing levels, better pay for those workers, to create CDC guidelines that will allow them to practice sheltering in place. And then I think the last thing is it may require a bold action where a temporary living situation might have to be arranged in order to keep our seniors safe. So there's a lot of work to be done, but the Cook County Department of Public Health has been very supportive in our effort to ultimately save our seniors during this crisis and those who, of course, have disabilities. So thank you, Dr. Joshi. It's really what I'm getting at too.
Thank you, Commissioner.
There's a question that it was sent ahead of time that I just was able to mine out of the data. It says, what is Cook County doing to increase the business it does with Black-owned businesses? Do I have someone from our compliance department online to answer that?
Yes, Edward Olivieri here, Director of Contract Compliance. Thank you very much for that question. So our office is working very closely with procurement and also the Department of Emergency Management and Regional Security to engage our MBE and WBE community. And so recently we sent out an outreach asking all of our vendors who have the capacity to provide PPE to submit their capabilities, their pricing, et cetera. And so that information has been sent over to Emergency Management Regional Security to engage in direct contracting with our MBE and WBE community.
And I will add to that I raise holy Hades at almost every meeting, particularly at our hospital meetings, when I don't see our African-American contractors getting a fair deal. So I think it's all of our responsibility to rally the troops when we don't see equity taking place. And that's why I commend the President so much, because she can't do it by herself either. We have to come behind her with this and make sure that it's happening. So again, as I said earlier, I think we have done a great job up to this point, but we still have a ways to go.
All right, we can't hear you, Denise.
How about now? Can you hear me now?
No, okay.
Yes, we can hear you.
Commissioner Dennis, are you aware of a program used to be called Target Program? And it would set aside project for minorities only.
I am aware of Target.
Is it still in operation?
I haven't heard anything about it.
All right. Why don't we let Eddie Oliveri or Rafi Sarafian, if they're on the line, respond? Let them help you out, Commissioner Deere.
Thank you, Madam President.
Of course, Madam President, again, Edward Olivieri from Contract Compliance. And so we do utilize target market programs for specific contracting opportunities. So target market programs are those where the contract is only available for MB and WB firms to bid on. We recently did one for architectural engineering services, county side, and we're going to be doing one also for architectural services on the hospital side. We're always looking for opportunities to engage on target market where we have sufficient MBs and WBs in the space to be able to bid. We've done it in the past, and we're going to continue to do it moving forward.
Thank you.
Okay, I could tell you a story about it, but I won't take your time here.
Thank you. We have a couple more questions that have come in. This one, I'm not sure if we have someone that can answer, but through the chat, it says, is Tom Dart going to take the pledge on Obama.org? And they cut and pasted all of the Obama.org reviews, points of review of police use of force, engage the community. All of them are pasted in.
All right, that's not a question we can answer. Sheriff Dart is a separately elected official, and that question needs to be directed to his staff, and perhaps we can find somebody in the communications office and connect the person with them. Okay? Communications office of the sheriff.
Thank you. Thank you, Madam President, and thank you for the question. We have another question that we fielded out of our questions in advance. It says, why is it so hard to get non-COVID-19 emergency assistance right now? Is that Dr. Joshi?
Dr. Joshi is in charge of public health, so
Public health, so.
the delivery of care is not on his,
Not in his
bailiwick. So let me just say, I think it was in February or early March, the Center for Disease Control basically told all the hospitals in the country to cease elective surgery, to free up hospital beds for COVID-19 patients. And at the height of the epidemic, half of the hospital beds in our hospital, we had about 250 people in the hospital at the time, and half of the beds were occupied by COVID-19 patients. And we know that there are tremendous numbers of people who have the disease and either have no symptoms or have very mild symptoms. So if you're in the hospital with COVID-19, you're really sick. So the CDC had tried to free up hospital beds to be sure that we had the capacity to deal with the epidemic. What we had to do, in addition to reducing eliminating elective surgery, was to try to go to telehealth to provide care for people. We closed our clinics and we've been trying to provide healthcare through telehealth. So basically in this time period, kind of everything else got squeezed as we tried to respond to the pandemic. But I encourage you, I think now the number of COVID-19 patients in the hospital this past week was 30. And again, it had been half of 250, so 120 or so patients. So we have more capacity in the hospital and more ability to deal with non-COVID related challenges that people have in terms of their health. So I encourage you to be back in touch with your primary care physician and to seek the care you need. We now have capacity in the hospital to better address challenges other than COVID-19, and we'll be moving to opening our clinics as well, which should enable more people to get the care they need. All right, Denise, we can't hear you.
It's good because I didn't say anything. So right now, I don't see any new questions. I don't see any hands raised, and we actually mined out all the questions that were sent to us in advance.
All right, thank you, Denise. I want to thank everybody, particularly our commissioners, Commissioner Deere and Commissioner Johnson, for joining us. All of you who were on our virtual equity town hall this evening. We have been doing this across the county. We started in the south suburbs. We did one in a bilingual one in Cicero, and then of course this one on the west side in the west suburbs. We thank you very much for joining us. We hope we've been able to answer your questions. I see in the chat feature that someone has posted the information about how to contact the sheriff so that you can get your questions answered from him. Denise?
With that, we thank you for joining us tonight and have a great evening.
You as well. Thanks so much.
Thank you.
Good night.
Thank you so much.